This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today. Welcome to the Global Men's Wellness. I'm Dr. Judson Brandeis, and I'm so glad you're here. So much of our sexual satisfaction is tied not just to function, but to the deeply personal sense of being in control, of timing, of pleasure, of the shared experience with a partner. When that control is lost, it can be a source of profound frustration, anxiety, and even shame. Millions of men struggle in silence with issues at the opposite ends of the spectrum, ejaculating far too quickly, or finding it incredibly difficult to reach climax at all. These aren't just minor inconveniences. They can erode self-confidence and strain even the strongest relationships. The good news is that for the first time, a comprehensive evidence-based roadmap exists to help men and their partners navigate these challenges. Today, we will explore the new clinical guidelines for disorders of ejaculation, moving this conversation out of the shadows and into the light of compassionate, effective medical care. So, what are we talking about when we discuss disorders of ejaculation? We are primarily looking at two conditions: premature ejaculation, or PE, and delayed ejaculation, or DE. It's crucial to understand that these are medical diagnoses, not personal failings. Premature ejaculation is defined by three core components: poor control over when you ejaculate, ejaculation that occurs very quickly during penetrative sex, typically within about 2 minutes, and significant personal or relationship distress because of it. This can be lifelong, meaning it's been a problem since a man's very first sexual experiences, or acquired, where it develops later in life after a period of normal function. Delayed ejaculation is the other side of the coin: a consistent, bothersome inability to achieve orgasm and ejaculate, or an excessive delay in doing so, despite adequate sexual stimulation and a desire to climax. The biological mechanisms behind these conditions are complex, involving an intricate dance between our psychology and our nervous system. The timing of ejaculation is a reflex controlled by the brain and spinal cord, and it's heavily influenced by neurotransmitters, particularly serotonin. This is the key to understanding how treatments for PE work. Many men with lifelong PE seem to have a lower baseline level of serotonin activity, leading to a faster ejaculatory reflex. Acquired PE is often linked to other health issues. For example, a man who develops erectile dysfunction may, consciously or subconsciously, rush to climax before he loses his erection. The biology of DE is less understood, but it is frequently linked to medication side effects. Ironically, the same SSRI antidepressants that delay ejaculation are a common cause of DE, as well as neurological conditions or low testosterone. The diagnostic process for both conditions relies almost entirely on a detailed and empathetic medical, sexual, and relationship history. While these conditions have been known for centuries, a formalized, evidence-based framework for managing them is brand new. The American Urological Association and the Sexual Medicine Society of North America published their first-ever clinical guideline on this topic in 2022. It was developed after a rigorous systematic review of over 1,800 scientific studies to ensure the recommendations are based on sound data. While there are currently no medications in the United States that are FDA approved specifically for these conditions, the guideline makes strong, evidence-based recommendations for the off-label use of several highly effective therapies. This is a landmark moment, as it gives clinicians a proven and credible playbook for helping patients. Given how common these issues are, why don't more people know that effective treatments exist? The primary barrier is the immense stigma and embarrassment associated with sexual dysfunction. Many men suffer in silence for years, believing it's a personal flaw rather than a treatable medical condition. These problems can also be overshadowed by other sexual health issues like erectile dysfunction. And because there are no FDA-approved drugs for PE or DE, there is no public awareness campaign or direct-to-consumer advertising that brings the topic into the mainstream. This guideline is a crucial step in normalizing the conversation and letting men know they are not alone and that help is available. The patient experience begins with a conversation. The goal is to create a safe space where a man can discuss his history, his relationships, and the distress this issue is causing, without judgment. For PE, the journey might involve trying behavioral strategies like the stop-start technique, or it may involve a prescription for a daily low-dose SSRI medication or a topical anesthetic cream to reduce sensitivity. It's a process of finding what works best with the fewest side effects. For DE, the experience is often more investigative. It starts with a thorough review of all medications, as these are a common cause. It may also involve blood tests to check hormone levels, like testosterone, and an exploration of psychological factors with a mental health professional. This leads to the cornerstone of the guideline: personalized care based on shared decision-making. There is no one-size-fits-all solution. A young man with lifelong PE might benefit most from a daily SSRI like paroxetine, which has been shown to have the strongest effect on delaying ejaculation. Another man might prefer an on-demand medication or a topical agent to avoid the side effects of a daily pill. The guideline also strongly recommends combining pharmacological treatments with behavioral therapy, as this can be more effective than either approach alone. For DE, if an antidepressant is the cause, the personalized approach involves coordinating with the prescribing physician to find an alternative medication. If low testosterone is a factor, T replacement therapy may be an option. The effectiveness of treatments for PE is well established and can be life-changing. Daily SSRIs can increase ejaculatory latency time dramatically, with some studies showing an 8-fold increase over baseline. Topical anesthetics are also moderately effective and offer a non-systemic option. The effectiveness of treatments for DE is much more uncertain due to the limited evidence base. Often, the most effective intervention is simply stopping or changing a medication that is causing the problem. What is most effective, for both conditions, is a comprehensive approach that addresses the biological, psychological, and relationship factors at play. Looking forward, the future of managing these disorders lies in developing more targeted and approved therapies. Ideally, we would have a fast-acting, on-demand medication for PE with a better side effect profile than the current off-label options. For DE, a deeper understanding of its neurobiology is needed to develop the first-ever targeted pharmacotherapies. There is also a great need for more research into combination treatments and for a better integration of sexual health therapists into the standard urological care model to provide the holistic support these men and their partners need. I do this work because I believe sexual health is an integral part of overall health and well-being. These are not life-threatening conditions, but they can be life-altering, causing immense distress that can fracture relationships and crush self-esteem. The better way presented in this guideline is about more than just prescribing a pill. It's about destigmatizing the conversation, validating a man's concerns, and empowering him and his partner with knowledge and options. By engaging in a process of shared decision-making, we can create a personalized strategy that helps a man regain a sense of control, restore intimacy, and rediscover the joy and satisfaction in his sexual life. Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.